This is the home guide to forefoot capsulitis. Capsulitis is the inflammation of joints in your body. Whether this is the shoulder, the foot joints, it's all the same, and the healing principles are all the same. So, especially on the foot, where this number 2 circle is, this is where capsulitis manifests most because the second toe bone's the longest. But it can also happen in the first, the third, the fourth, the fifth, and spread everywhere around there. Bursitis is a little bit different. It's a little bit in the front, but the beauty is all these are treated the same. Most pain in the forefoot is treated the same. Common causes are pain with motion as you bend the toe all the way up, all the way down. It hurts. Pain the longer you stand on your feet, especially your forefoot, and it feels like there's a marble or just your forefoot is swollen inside your shoe. Now, this is how 75% of people with forefoot pain can be healed. Take a 2-week course of anti-inflammatory pills. This is ibuprofens, Aleve, Advils, whatever you want to take, any type of anti-inflammatory. And I'm going to explain how that works in a second. You could also ice for 15 minutes a couple times a day after you get home from work or after being on your feet the whole time. Or you could tape your toes down, use pads on your feet. Now, if you want to know how to do this more specifically, click on the link underneath the video and it'll take you to the website and there'll be videos for how to do that. Or you can elevate your foot. Now, what these all do is they decrease inflammation. They prevent white blood cells in your body from releasing factors that start attacking the tissue in the area where you have pressure. The reason this happens is because the body has to break them down to heal them. But if you're on your feet the whole time, this is very difficult to do. You can't take a weekend off or a week off if you're working all the time, playing sports, whatever. So, what the anti-inflammatories do, they prevent the cells from releasing them. Ice slows the cells' movement down, prevents blood from flowing to the toes as much as it was before, and elevation also prevents blood from flowing there. Studies have shown each method greatly decreases inflammatory cells from releasing their markers, their cytokines, and breaking the tissue down more. So if you do these things alone, come to the website underneath this link to learn how to do them more specifically, because this is a quick overview, but 75% of people will be taken care of. Now, if you go to your podiatrist, injections, a podiatrist has a mixture of corticosteroids, anti-inflammatory mixtures, B12, whatever, that's injected into your foot that even more greatly decreases inflammation. And in addition to giving you foot inserts, whatever, they'll assess your biomechanics. If you have tight hamstrings, if your knees are tight, if your hips are tight, if your back's tight, errors in the way you walk, and what's leading to the problem more specifically. Now, the unlucky 1 in 20 people will need surgery. Unfortunately, the statistics show. You may have a bone spur, you may have an abnormally sized bone, you could have a bad nerve, constriction, anything that simply these conservative treatments won't take care of. So just a quick summary. If you ice, use anti-inflammatory medication, and stretch, 70% of people will be fine. If you add the pads, the taping, the elevation, another 10% or so of the resistant cases, orthotics, an injection, a biomechanical evaluation, 19 out of 20 people will be amazing. And then for the unfortunate 1 out of 20 people, you will need some kind of manipulative or surgical treatment. Do not try any of this at home alone without supervision. This is presented by Michigan Foot Doctors. If you think our information helped you, give us a thumbs up and come visit the site for even more.